Hi everyone. I'm first of all very honored to be a part of such a distinguished panel of speakers. I've heard everybody here, and I think Anand sir himself is such a prolific speaker. I thought I'll do it slightly differently. I'll probably ask a few questions along the way because I know that we have a house full of doctors. We have somebody who specializes in ethics of AI over there, and we also have several technologists and government officials. So I'm Srishti. I'm founder and CEO of Infiheal. I'm from IIT Bombay, and I also worked as a Chief Minister's Fellow in Government of Maharashtra, where I worked for 10 tribal districts in Maharashtra. And before building this, I had my own journey where I understood the gaps in the mental health ecosystem, which I tried to address through what I've built using technology. So, if I really have to ask everybody here, what are the major gaps in mental health? I think the first thing that comes to mind is stigma. Mental health is a huge stigma. In fact, over 150 million Indians struggle to access mental health care, but the economic survey says that almost 90% of the people never access it, never avail it, and that's a massive gap. And one of the major causes of that is actually stigma. But even if we set that aside, there are actual constraints in terms of the supply. We don't have access to, not everybody has access to hospitals. Only in big cities do you have access to mental health care. And most importantly, there are long wait times. If you go to any government hospital, you probably have to wait for a very long time to avail those services. And if you take a private route, you will end up spending around 1,000 rupees per hour, and you would need 4 such sessions to actually see any kind of benefit in a month. So 4,000 rupees per month is something that few of us can afford. Finally, misdiagnosis is rampant because of the fact that most doctors have to make a quick diagnosis. Often, personality disorders and mood disorders are switched, which causes a lot of problems. Okay, which okay, which causes a lot of issues. I hope I'm audible. Yes. So which causes a lot of issues in terms of people getting the right kind of outcomes. There's also no mental health record. There's no centralized repository of records. So what happens is, if I go to a therapist, and if I want to change my therapist, let's say I move to a different location, or for whatever reason I find that I have a different problem and I need a different specialist, I will actually have to disclose my entire history again, which is extremely uncomfortable. As it is, there's stigma. We don't want to talk about our problems. So this actually compounds it significantly. We also find that there's a lot of good research happening, but it doesn't reach the end user. Why? Because in terms of continuing medical education, there's not much happening in mental health realm. So everybody has to do their own research. They have to do their own courses. Most of the courses are extremely expensive. So there is in general poor academia to industry transfer. So how do we address it? I think we go to the next slide. We address it by leveraging technology and leveraging AI. What we have done is we've built an AI therapist. It's called Healo, and it actually shot to prominence when PM Modi mentioned it in his Mann Ki Baat speech. We have been able to work with the government, especially Ministry of Social Justice and Empowerment, and we hope to also work with the Health Ministry as well as Department of Northeastern Development and Northeastern Region. So why do we think that AI can potentially be a solution? We think that because since COVID times, there have been greater acceptance of solutions like this. We found that a lot of people who would not otherwise take therapy began going to therapists, right? Also, we see in general a surge in use of AI technologies. Like more and more people are now using Chat GPT for their problems, which was not happening earlier. AI itself has improved significantly in terms of diagnosis and in terms of algorithms, and we find several notable use cases for the same. We also find certain supply side constraints, meaning that doctors can't service, they don't have the capacity to service the existing number of patients, and there are long wait times. So this makes AI a unique solution which can offer scale at 1/20th the cost. Next. So our solution actually involves leveraging generative AI using LLMs. So LLMs, all of us, I think, may have heard of. Have people heard of ChatGPT? I'm guessing people have. So chat GPT is sounds very really intelligent, right? But it has certain problems. It hallucinates, meaning that it doesn't give you the outcome that sometimes you request it to, right? Because ultimately it's a question of the data that's fed into it, right? So how do you solve that problem? You basically use your own data set, which is a proprietary data set comprised of therapy sessions. So that's what we've done. We're one of the largest repositories of therapy transcripts that we added to generative AI to get an output which hallucinates much lesser, which has made AI much safer. And we also use a multi-agent system. So multi-agent system, not to bore you with the technical aspects. Single agent systems are capable of handling a specific type of a use case, a niche use case. But if you have something as complex as mental health, where in fact people don't even know whether they want to vent or do they want a solution. A lot of times when we talk about our problems, we don't really want a solution. We just want to be heard, right? And sometimes you do actually want somebody to proactively give you advice. So how does an AI distinguish that? And how do you design flows that actually accommodate both those aspects, right? So multi-agent system is something that's absolutely necessary to accommodate for the complexity of AI. We also have something called as graph rack. Graph rack is a fancy word for a retrieval mechanism. So it's able to pick the best use cases from the data set. And because it's able to pick the best use cases, it's able to provide a very hyper-personalized kind of a solution, which mostly other platforms or other solutions cannot. There's also therapist alignment. In fact, we have our therapists in-house here today. Our team has actually built our data set from scratch, and they have actually worked to fine-tune and validate the data set as well. And finally, you need guardrails. What if somebody who is suicidal actually comes on your platform? What do you do then? All of these actually raise some ethical questions, which I'll address subsequently. Next. So what we do is we don't think AI can be a standalone solution. I think that they are humans that are needed in every step of the way. Wherever affordable, we can match people to therapists, which is also what we do. Anybody who comes in with any clinical diagnosis like ADHD, autism, OCD, they are matched with the right therapist for the needs based on their conversational history. People who are suicidal or who are having a psychotic breakdown, they are actually connected to distress helplines. AI doesn't actually deal with those cases. But when it comes to low risk cases that all of us actually go through, work life balance issues, parenting issues, academic stress, even relationship problems or loss of a loved one, things which are relatively universal but not clinical in nature, that's where AI actually is capable of handling quite a lot on its own. Of course, with certain guardrails and safety mechanism. And what do we do? What do we do for each of these cases? For low risk cases, we can easily provide people with a bunch of exercises, meditations, guidance, counseling, and AI can even act as a sounding board because it has the data fed into it, which is built by therapists. But when it comes to high risk cases, that's where we provide people with a safety plan and match them to distress helplines right away. Next. So this is our product. I don't think we'll have time for the demo, but we basically have an AI chatbot. Think of it as an AI chatbot that's voice enabled. It can talk in 93 languages, and you can type pretty much anything that you can think of, and it's capable of handling any and every query around mental health and around sexual health. Aside from that, this AI actually also is capable of matching you to therapists when needed on its own. It's able to infer what you need and it matches you to the therapist appropriately. It also has an SOS button, kind of like a distress helpline, to connect you in moments where you need that human touch. And then, of course, it has a community feature where it's kind of like Reddit, but it's peer and moderated and psychologist moderated. So psychologists actually see who's posting anonymously. What if there's some red flag, there is an escalation. Next. This is our team. So I'm Srishti. I'm the founder and CEO of IIT Bombay. My co-founder is from Boston University, a CS grad from Boston University. We have Professor Sujan Anthony from NIMHANS and Professor Prakhar Jain from Bombay Hospital as well. And Jasdeep Magu, who's a neuropsychologist, and as well as a board of psychologists who are present here today. Next. So far, we've had over 1 lakh people on our platform, and we've seen a fairly high satisfaction rating of 91%. 91% people who used it found it useful in either symptom alleviation or mood improvement. And we partnered with, of course, Ministry of Social Justice and Empowerment, primarily NEPED and all the CRCs, and NIMHR. We also have partnerships with NGOs, hospitals, as well as academic institutions. Next slide. So they have been a lot of research that have been done. More specifically, we have studied how AI actually works in EAP programs, employee assistance programs, and that's where you get a lot of low risk cases, and it can be extremely useful. It's also extremely useful in case of dealing with disabled population because it provides a ready tool that people can access 24/7 without having to move much. We also are doing our own research, which is chatbots as a tool for psychoeducation. Next slide. This is just some of our highlights recently. PM Modi mentioned us in Mann Ki Baat, in the 108th session of Mann Ki Baat, and he highlighted the growing mental health burden that India might be facing and how tools like ours actually can help bridge that gap. We also, this is our MOU signing, the Ministry of Social Justice and Empowerment. We've had some prolific people who have endorsed us. We've had Jensen Huang, who's the founder of NVIDIA. We also had Jackie Shroff and a few others who have endorsed our product. So yes. Next slide. Yes, some of our industry partners that we are currently engaging with. You have Google, you have NVIDIA, you have Microsoft, Forbes, etc. That we are working with, and we hope to work. Firstly, have workshops for the Northeast where we focus on awareness generation. I think that's the first step, and secondly, maybe enhance the adoption of tools like this in a way where the community is actually participating with full force. Thank you so much for this opportunity. Thank you. Thank you.
Thank you, Srishti. The purpose of asking her to speak is that we are running some workshops with the colleges already. I will also request our representatives from three major medical colleges in Northeast, in fact, four of them. So, AIMS Guwahati, RIMS Imphal, Nagaland. We have from Dibrugarh and Guwahati also here. What I would request is that why don't we use this tool to run a program for families affected by cancer? See how it responds. My study when I was working